rollout of the vaccines and saving the lives of our people. So thank you very much. It's wonderful to be here. Thank you.
Thank you, Mr. President. Colleagues in the media, we're going to allow only 5 questions, and these are the questions that will be directed solely to the President, and the questions that will be directed to Aspen, the executives of Aspen will remain answering those, but now we're going to take only questions directed to the President. Can I see the raise of hands? I'm seeing 2 hands. 3. So, Governor, 1, 2, 3. It's 3 hands that I'm seeing. I'm closing on 3 hands. Thank you. Go ahead, Scott.
Thank you so much, President Scovin. President Scovin with us from ENCA. How many of the vaccines that are being made here that are under production will be given to South Africans, and how many will be for export? And then while you were in there, you were explained, the official explained the price per dose, and that there were a number of doses in the vials. Could you just clear up what that price is? Is that the price that we as South Africa are buying it for, or is that the price that it will be bought for once it's exported? Thank you so much.
Thank you. Number 2.
My name is Malunga. Mr. President, your government has come under criticism of faith, especially from political parties and also...
Malunga, can you increase the volume?
Okay. My name is Malunga from Newsroom Africa. Mr. President, your government has come under criticism of late, and also not only from political parties, but also from some South Africans over the slow pace of inoculation in this country. What would you say to people who say government has failed in its vaccination program? The second question is, when exactly are we going to see this facility producing these vaccines? I know you've spoken about April. Is it at the beginning of April or at the end of April? Thank you.
Malungelo, that question should be directed to Aspen. I'd like Aspen to respond to that one. So I'll take the other last question. There's the lady there.
Afternoon, Mr. President. Noma Zimangosi from the Herald. I just wanted to ask, I'm not sure if you've seen the videos circulating, particularly from the Metro this weekend, where we had large gatherings, parties. So I just wanted to ask if we can expect stricter restrictions ahead of Easter weekend.
Thank you, Mr. President. It's over to you. There are 2 questions. The question of Malungelo will be responded to by Aspen because of the details that the executive is going to know. Thank you, Mr. Over to you, Mr. President.
Well, the first question was how many will we get? We have confirmed and signed that we are going to be getting initially 30 million vaccines out of this facility, and 220 million will be vaccines that will be spread throughout the continent. So here, 30 million, and as you well know, we've got a multi-supplier system of acquiring vaccines. Johnson & Johnson is one of those that we are buying vaccines from, and there are a number of others. And we continue to negotiate with a number of suppliers. Minister of Health and his official, together with Finance, continue to be seized with that whole process. And there are many others, and Minister of Health, if you care, will be able to clarify all that. And the pricing is also an affordable price because we are not overpaying, and it is part of the agreement process that we are involved in with Johnson & Johnson and a number of other suppliers. What we have tended to focus on is to acquire vaccines, and there's great competition around the world about acquiring vaccines, and we have focused more on saying we've got to acquire vaccines as quickly as possible so that we can save our people's lives. Malungelo says that there's criticism against government for the slow pace of the rollout. The slow pace which I spoke about initially, in saying that our coming here is going to add impetus to the process of rolling out. The slow pace has been given rise to by the availability of vaccines. You will remember that we acquired vaccines initially from India, and through scientific processes we found that they were not efficient or efficacious for the variant that we had. And we had then to source other vaccines, and we used the Johnson & Johnson vaccines that were used in the trial process. And we were the very first, I guess, in the world to use the Johnson & Johnson vaccines, and they were used and they are being used for the vaccination of our frontline workers. And in the process, we are acquiring more and more vaccines. So availability is a challenge that all countries in the world are going through. You go to Europe, you'll hear that they've got a challenge of availability. Japan has started much later as like the third largest economy in the world in vaccination, because availability also for them was a challenge. A number of African countries had thought that they would start earlier, but availability has been a major challenge. So we need to look at the issue of availability and look at the efforts that we are now embarking upon and making. And part of the reason why we come here is to ensure that we speed up the process of the availability of our vaccines. And that is why we had to confirm that we are going to get our 13 million vaccines from Johnson & Johnson. The Minister will be able to clarify that our negotiations with others are at an advanced stage, and in fact we've confirmed with others we're waiting for the Pfizer vaccines to also be delivered. So we are on an ongoing basis accumulating more and more vaccines. And in terms of the phases, we are still in the first phase. People tend to think that we've lost time. We've lost a little bit of time, but we're still on target in terms of our phase, and we're now going to speed up the whole process of getting these vaccines. So losing a little bit of time does not mean, in my book, that government is failing. Government has been committed, absolutely committed, to saving the lives of our people and making all efforts. And if you care to know, we have not been sleeping on the job. And if you look into the eyes of the minister, also the DP, you'll find that there are red specks in their eyes because they don't sleep. And making sure that indeed we work very hard to get those vaccines. So we wanted to know when Aspen will be able to answer that, because the production line, we saw the production line, we saw how the vaccines are now being produced and packaged. We saw that for ourselves, which is precisely what we wanted to see. So we've seen that production has commenced and it's going to start picking up much more. I had wanted to come a lot earlier. I'm rather glad I came now, when they are now in the real action of producing the vaccines. So pace is picking up, and we will be able in days, because the commitment and the agreement says in April they must be able to start giving us the various batches. And because production of the 30 million does not happen in one day, it's going to happen sequentially, and they are going to be delivering as and when that happens. Restrictions in the light of the fear that there might be a third wave, and the light of the holidays that we are going into, that is going to be finalized by the National Coronavirus Command Council, which meets tomorrow, and we should be able to also discuss the matter with our provinces. Our Premier here participates in that, and our Mayor also participates. So they will be able to give us the lay of the land in the province and tell us how we are all behaving here in the Eastern Cape and in Gqeberha in relation to whether we are observing the various protocols or not. And if we find that our people are not really observing the protocols and there's a fear and a concern that there could be a further surge, then we will have to re-examine our position and say, do we need further restrictions? The restrictions that we've come up with have helped to curb the continuing growth and the rise of the infections. But having said that, the matter is going to be discussed tomorrow by the National Coronavirus Council, and we'll get a report from the Eastern Cape here and get reports from other provinces, and then a decision will be taken and an announcement will then be made. So thank you very much. It's been wonderful being here, and thank you for all your questions.
Thank you, Mr. President. And the question that is directed to Aspen will be responded to when the President and the interrogators left, because they are behind time. Thank you. Over to you.
Minister, thank you very much. We have reached the final agenda item now. The President has spoken, so all that remains to be done is a final vote.
And so we come out of that briefing in Gqeberha where President Cyril Ramaphosa was responding to questions about criticism about the slow vaccine rollout, as well as whether we will have a stricter lockdown, both of those still to be determined. My colleague Arabile Gumede is standing by with Bright Kumalo with your market news and some analysis after a short break.